Thank you, Honourable Chair. Let me say you are all recognized, all protocols observed for the sake of time. May I say my first gratitude goes first to the partners in population and development and the United Nations Population Fund for entrusting and believing in Zimbabwe as the host of this conference. I'm very pleased and honored for that gesture. I'll try and summarize so that everything fits into the 5 minutes. The government of Zimbabwe, through the Ministry of Health and Child Care, has long been committed to providing and continuously improving access to quality integrated family planning and sexual reproductive health services to its citizenry since the attainment of independence. The enactment of the Zimbabwe National Family Planning Act of 1985 and the establishment of the Zimbabwe National Family Planning Council, the ZNFPC, demonstrated the high commitment by my government to offer quality, comprehensive family planning services as part of primary health care. The Zimbabwe National Family Planning Council is an independent agency mandated to coordinate, monitor, and take leadership in the provision of quality integrated reproductive health and family planning services. This agency is also the country coordinator for South-to-South cooperation for Zimbabwe. To show how committed we are as a country into respecting human rights issue of family planning service provision, the board of the Zimbabwe National Family Planning Council is appointed by me and reports to me as the Minister of Health and Child Care to ensure that it carries its mandate perfectly. Distinguished guests, in a bid to track that the commitments of the International Conference on Population and Development are achieved, the government established a multi-sectoral national task force which periodically meets to coordinate, monitor, and evaluate the implementation of the program of action. The task force employs a whole of government and whole of society approach to ensure that all stakeholders contribute towards meeting the commitments we have made. The existing National Family Planning Forum and Sexual Reproductive Health Forum, coordinated by the Zimbabwe National Family Planning Council, provides technical leadership to all service providers in the country. Through these platforms, public-private partnerships have been developed and implemented, leading to improved quality family planning and reproductive health services provision for our citizens. We strongly believe that solid, tried and tested coordination within the country sets up a strong base for successful establishment and implementation of both South-to-South and triangular cooperation. I am honored to testify that Zimbabwe has benefited tremendously from South-to-South cooperation. In 2022-23, Zimbabwe replicated lessons learned from the Ghana Adolescents Sexual and Reproductive Health Project. The program trained school health clubs and service providers on the provision of comprehensive sexual reproductive health services, and this helped to increase the uptake of sexual and reproductive health services. Through South-to-South and triangular cooperation with other nations, Zimbabwe has managed to fill gaps in health service provision, including sexual reproductive health, through medical and other health specialists coming into the country to provide health services from countries that include China and Cuba. Through South-to-South and triangular cooperation, Zimbabwe has benefited in human knowledge and capacity building. Periodic fellowships offered by partners in population and development have seen various members of our health workforce obtaining postgraduate qualifications in important areas such as public health management, policy and population analysis, population and sustainable development. We remain grateful to partner countries for providing these opportunities and exchange programs. Distinguished guests, for us in Zimbabwe, there are various challenges that we are facing in the area of family planning and sexual reproductive health, and indeed the health sector as a whole, that we believe can be tackled through South-South and triangular cooperation. Let me briefly share a few of them with you. Zimbabwe is not an exception from the common problem of health worker attrition from developing countries to developed countries. My country invests so much in the training of nurses, doctors, laboratory scientists, radiographers, yet it is like pouring water into a bottomless pit because they emigrate to greener pastures abroad. In my country, even the educators, such as nurse trainers, are leaving fast, making accelerated training to replace the living nurses a non-viable option. I believe this is one big problem that is not peculiar to Zimbabwe, but to many, if not all of us here. It is only through coming together, through multi-country South-South and triangular cooperation, that we can sustainably address this problem, sharing ideas and learning from each other. Secondly, our unmet need for family planning is still high at 10%. While teenage pregnancy rate is as high as 22%, that is using the Zimbabwe Demographic Health Survey of 2015. If we can embark on a multi-country collaborative programs, this will not only respond to operational questions pertaining to family planning and sexual reproductive health issues, but also embark on research and development for the local manufacture of contraceptives and commodities that better meet the needs of our population. This surely will be a good way to further reduce the unmet need for family planning in our countries. As we continue to invest in these programs, we have seen a considerable decline in fertility rates from 5.4 children per woman in 1988 to 3.9 children born to a woman in her lifetime in 2022, and maternal mortality rates declining from 462 per 100,000 births in 2019 to 363 per 100,000 births in 2022. There is also a significant increase in modern contraceptive prevalence rates from 36% in 1988 to 69% in 2022. Thus, technically, more families now have access to family planning services that enable them to make informed decisions about when and how many children to have. As a result of these programs, we have seen a positive impact on the age structures of our population. Our young population is growing, and this presents us with an opportunity for economic growth and development. We need to invest in our youth by providing them with access to education, healthcare, and job opportunities to take full advantage of this demographic dividend. In conclusion, let me emphasize that our progress in improving maternal health and reducing child mortality is a vital aspect of our development. Our mantra remains, no woman should die whilst giving birth. As we continue to invest in these programs, I am confident that they will continue to bring significant and positive impacts on our population, and we will emerge prosperous and healthy. I would like to remind each one of you that increased engagement of the international community in South-South cooperation will unlock more resources for developing countries to pursue their national development plans and to meet the sustainable development goals. I thank you and will remind you to visit the Victoria Falls. Thank you.